Hi, I'm Peter Morley. I'm a patient advocate. I have traveled to DC 32 times. This time I am not in DC, but I'm honored to be with Congressman Swalwell of the California Congressional 15th District. And thank you, Congressman, for everything you've done to protect our care. I'm a patient and a patient advocate. I suffer from chronic illness. I live with lupus and over 10 other pre-existing conditions. I wanted to speak with the Congressman today to highlight what is going on in the Supreme Court for the ACA and what that would mean to you.
Well, thank you, Peter. I wish you and I were meeting as we often do when you come to Washington. It's so nice to see you, and I know I'm not just meeting with you. I'm meeting with millions of patients who count on your advocacy, and you're in it not just for yourself. You yourself as a patient, you're fighting for your own health, but you're fighting for the health of so many others. To me, we're in the public health crisis right now. We have 5% of the population of the world. We have 20% of the deaths in the world right now from this pandemic. It takes the next two largest countries' deaths to add up to what we have in the United States. You would have to take essentially Brazil and India to equal the amount of death that we've had in the United States. India, of course, a country with 1 billion people. And so we're failing this test right now. And the worst thing that we could do when we're failing a public crisis test would be to have fewer pathways to care for patients in America. In fact, if we're going to get this right, we're going to have to expand the Affordable Care Act, not contract it or get rid of it. We have a vaccine that is going to have to be distributed as soon as it's safe. And I hope that vaccine is free for every American. And it's probably going to be multiple vaccines, and it may have to be, an annual or biannual distribution of vaccines. And so we need to make sure Americans are inoculated and that they have access to care. So the president, going to court, supporting these states who are trying to dismantle the Affordable Care Act, he is making us, less safe, less inoculated, and less able to be healthy at a time, at least in our lifetime, where we need it the most.
Well, I thank you for sharing that. The Supreme Court case that is happening exactly 1 week after the election that the president spoke about the other night, how he wanted to protect 135 million Americans with pre-existing conditions, is a bold lie, because there already is a protection for that. It's called the Affordable Care Act. And, I know you'll do everything you can to help fight it, but do you, I often ask this of members, do you think that sharing your personal story of healthcare with your member of Congress is important?
It's so important, and being a candidate for president, something that was so impactful for me on the trail, was meeting people who would share their stories. I have, insulin vials that were given to me by people who told me, I can't afford to give this to you, but I want you to know how much it means to me because of the cost of it. That I'll never forget. And even as a member of Congress, that those stories from your constituents or people like you who are advocates for my constituents, it really touches our hearts and hopefully inspires our minds to find solutions, because healthcare is complicated, but it's not complicated when the person sitting in front of you and they are telling you what it means to them and what it's costing them.
Well, thank you so much for taking time. I know you are extraordinarily busy right now. So I am going to let you go on with your day, and thank you.
Keep it up, Peter. We need you in the fight.
I'm not going anywhere. I'm here right with you, and I know I speak for millions of Americans. Thank you from the bottom of our hearts for everything that you do to fight for healthcare.
Of course. Thanks, Peter. All right.
All right.